Great, thank you. Welcome to everyone, and it's a real pleasure to talk to you today. I'm going to talk about functional GI disorders in children and adolescents. And I don't have any financial disclosures. I just want to acknowledge Dr. Peggy Marcon, who's one of my colleagues, for helping me put together some of these slides, because it's a little hard to do so with only one hand. So this talk is going to be brief, but what I do hope that you'll get from it is really to have an understanding of some of the common types of functional GI disorders in children and adolescents and what their symptoms are. And we are learning more about what is the underlying cause for some of these disorders, so we're going to talk a little bit about that and then very briefly talk about some management strategies because there'll be other speakers that will talk to this issue as well. When we think about gastrointestinal disease in children, there's really two types that we think about: organic and functional. And organic disease is diseases where there is actual tissue damage that we can see. Functional disorders, there is not tissue damage that we can see. But functional disorders can sometimes have even more impact than organic disease in children and their quality of life. So they're very, very common. We see lots and lots of functional GI disorders, and they do contribute significantly to impaired function for children, and as I said, they can impact their quality of life, which is very important. For physicians, if they don't have an awareness of what the symptoms are and how to diagnose these disorders, then it can result in extra tests that aren't necessary and extra costs that aren't necessary. So it's really important that physicians understand how to diagnose these disorders so that they don't do extra tests. And importantly for patients and families, if you receive a diagnosis, a positive diagnosis of a functional GI disorder early in your disorder, then you actually do better. So we want people to understand what the diagnosis is, that they can then move forward and have a positive outcome. There are some common features for functional GI disorders. And in essence, for the physician diagnosing this disorder, after appropriate medical interventions, and that might just be history and physical exam, it doesn't mean you have to do lots of other tests, you can't attribute the symptoms to another medical disorder. Now, sometimes functional GI disorders can coexist with organic disorders. So, for example, a child can have celiac disease, but also have functional dyspepsia, where the symptoms are in the upper gastrointestinal tract. Because we have a better understanding of some of the mechanisms behind what causes these diseases, we now know that some of them can have shared underlying mechanisms. And because of that, that means that how we manage them can be similar across these disorders. As a physician, we diagnose functional GI disorders based on symptoms, and they're classified into what are the predominant symptoms. And there is actually a criteria, it's called the Rome criteria, for diagnosing these disorders. So they can be broken down into those disorders that the most common symptoms are nausea and vomiting. Those where the most common symptoms are problems with bowel movements, so constipation. And those where the predominant symptoms are abdominal pain. So I'm just going to go through very briefly some of these disorders, just so that you have an understanding of what they're associated with. So there can be something called cyclic vomiting syndrome. This is a very dramatic disorder where children have really intense, repeated episodes of vomiting that can last for hours and sometimes even days. And in between, their health returns back to normal. So this can be very distressing for patients and families. There can be functional nausea and vomiting, where children experience nausea or vomiting, and we don't find any underlying organic cause for it. Rumination syndrome is where children will bring up food into the back of their mouth, chew it, and swallow it again. And aerophagia is where you swallow air. This can sometimes result in bloating and lots of burping and lots of farting. So these are the functional nausea and vomiting disorders. Functional defecation disorders, so these are disorders where changes in the bowel habits are predominant. So constipation, functional constipation is very, very common. And here it can often begin with fear to actually go to the washroom. Children can then withhold stool, and by withholding that stool, the colon absorbs water, that's what it does, so the stool gets harder. It gets bigger over time because the child's not defecating, and the bowel is a tube, so if you start getting more and more in it, it can get bigger and bigger, such that then it becomes harder for it to contract and have a bowel movement. So it becomes a vicious cycle, and this is functional constipation. Because there's a big sort of plug in the bottom of the bowel, then sometimes liquid can seep through, and so children can have problems with soiling as well. So this can all be associated with functional constipation. Functional abdominal pain disorders are also very common in children and can transcend from childhood into adulthood as well. So functional dyspepsia, this is where you have epigastric pain, so pain in the upper part of the chest. You may feel full early after eating, and again, this can extend from childhood into adulthood as well. Irritable bowel syndrome is where you have pain that's associated with change in bowel habits. So you may find the pain when you have a bowel movement. Your bowel movements can change. They may either be constipated or they may be loose, and that can fluctuate as well. And then finally, abdominal migraine. So this is where children have incapacitating abdominal pain. And it is almost like a migraine headache. So some children will have an aura almost with it, so they can get photophobia. So that's light really bothers their eyes, just as you would get with a migraine headache. You can also get headaches associated with it, nausea, paleness. And again, it's incapacitating, so children really can't function. So it's very dramatic for patients and families. And as I said, we now are getting a better understanding of these disorders. Years ago, we had no comprehension of why these things were happening, but we now know that there are several different factors which come into play. So children may have a genetic predisposition, so their genes might make them more likely to develop these syndromes, and there can be early life events, so very early in life, that may impact how the child's gut senses pain. There can be sensitizing medical events that can happen. So for example, we know now that infections can be associated with the development of functional abdominal pain syndromes. Distension of the bowel, or if the bowel's not working properly, these can come into play and change how the body senses pain in the abdomen. And there may also be sensitizing psychosocial events as well. There may be depression or anxiety, family stresses, how the child copes. There may be some secondary gain for having these symptoms, and stress. So all of these factors can play in together and result in the development of abdominal pain or other GI disorders. And so thinking about what can be involved in causing these symptoms or these syndromes helps us to think about management. And so for your family doctor or for you as parents, once there's a diagnosis of an abdominal pain-related disorder, understanding what some of the mechanisms that are involved in this development, we can think about how do we manage this. So first of all, education is paramount. Reassurance that there's not going to be damage to the organs from these disorders. Educating about what are some of the factors that could be involved in the development of these disorders, and these are real disorders. They're real disorders, and we have some understanding of what causes them. Managing lifestyle and food habits, and again, we're going to hear a little bit more about that later, and discussing expectations. So it may be that in the management, we're not able to completely eliminate pain, but our goal really is to improve quality of life and make sure that that child moves towards a normal lifestyle. Sometimes having a pain diary is important because you may identify triggers that are associated with the symptoms. And once that's happened, you need to reassess, reevaluate, and if things still are not working, then we can start some therapies. And you're going to hear a little bit more about that. So behavioral therapies can be effective. Sometimes we need to use pharmacologic therapies, probiotics. So there are different things that we can do to treat these disorders depending on what the underlying symptoms are and what we want to improve. So in summary, functional GI disorders are common in children, and it's important that we make a diagnosis early on, that we don't do extra tests that can be invasive for the children, that cost money, that don't actually help. Understanding the diagnosis and getting educated about the diagnosis can really help improve outcome and get management on the right track. And again, the primary goal of treatment might not be to completely resolve all of the pain, but to allow children to have a normal quality of life and get back to a regular lifestyle. So thank you very much, and I'm going to pass it on to Tom.